Birth control options in the U.S. Barrier and natural methods. Welcome back to our final video in our three-part series discussing birth control options in the United States. Birth control, sometimes called family planning or contraception, gives women the power to decide when and if they want to become pregnant. There are many types of birth control. By understanding the different types of birth control, how they work, and what you like and don't like about each type, you can choose the method that is right for you. In this video, we explore barrier types of birth control that can be used every time you have sex: condoms, vaginal gels, and spermicide. We will discuss natural methods of birth control like withdrawal and fertility awareness. And we will also discuss emergency contraceptives, sometimes called the morning after pill or Plan B. Condoms, vaginal gel, and spermicide reduce the chances of getting pregnant. But because they must be used correctly every time you have sex, they are not as effective at preventing pregnancy as other types of birth control. On average, 13 to 24 out of 100 people using these methods become pregnant in a year. These methods don't require a visit to the doctor or a prescription. They are available for sale at most pharmacies and many grocery stores. Condoms. Condoms are the only birth control method that protects you from sexually transmitted infections like HIV and chlamydia. Condoms are the easiest form of birth control to get and are commonly sold in pharmacies, grocery stores, and gas stations for a few dollars. Condoms are also provided for free at some clinics and local health departments. Unlike most forms of birth control, condoms don't contain any hormones. Condoms work by creating a barrier that lowers the risk of pregnancy. Check the expiration date and never use your teeth to tear open a condom packet. It is important to make sure the condom does not have any tears, and only one condom should be used at a time. Condoms do not cause any issues with menstruation and are safe to use while breastfeeding. There are two types of condoms available: external condoms, also known as the male condom, and internal condoms, also known as the female condom. Both condoms are thin pouches made of latex or plastic, called polyurethane. If you are allergic to latex, make sure to use polyurethane condoms. External condoms are a thin pouch that is placed over the penis. They are then removed and thrown away after use. You do not need a doctor's appointment to get external condoms from a store or pharmacy. Internal condoms are a thin pouch that can be placed in the vagina prior to having sex. They are then removed and discarded after use. Internal condoms can be purchased at a pharmacy without a doctor's visit. Visit the National Health Service if you are interested in a demonstration on how to properly use a condom. Vaginal gels and spermicide. Vaginal gels and spermicide are a thick liquid or foam that is inserted in the vagina before having sex to prevent pregnancy. They are about 82% effective at preventing pregnancy when used alone, but can be more effective when used in combination with condoms. They will not cause any changes to your period and are safe to use while breastfeeding. Possible side effects include an allergic reaction and irritation. To purchase vaginal gel, you may need a prescription from the doctor to pick it up at a pharmacy so that it is paid for by your health insurance. Spermicide can be purchased for about $5 at pharmacies and grocery stores. Natural method. Withdrawal. Withdrawal is when the penis is pulled out of the vagina before ejaculation. While the withdrawal method reduces the risk of pregnancy, there's still a high chance of becoming pregnant. About 20 out of 100 people become pregnant within a year of using the withdrawal method. If you choose to use this method, it's important to discuss it with your husband or partner, since you will need their cooperation to interrupt sexual activity. It can also be used in combination with other birth control methods. Natural method. Fertility awareness. Fertility awareness is when a woman tracks her periods, body temperature, and vaginal discharge to predict when she is most likely to get pregnant. During those days, sex is avoided or condoms are used. This method does not work well if you have irregular periods because it requires you to track your period, body temperature, and vaginal discharge for a long time. This method is 76% effective, but depends on a woman having a good idea of when she is most likely to get pregnant. For more guidance on fertility awareness, you can ask your doctor. Emergency contraception. Emergency contraception are pills taken from 1 to 3 days after a woman has had sex to help prevent pregnancy. It is 75 to 89% effective at preventing pregnancy if taken within 3 days after having sex. Emergency contraception is sometimes called Plan B or the morning after pill. Emergency contraception should not be used each time you have sex, only in an emergency. It is meant to prevent pregnancy if you unexpectedly did not use birth control, or if you believe your birth control method has not worked. You can buy emergency contraception for about $50 at some pharmacies, or you can get a prescription, since most health insurance will cover the cost of this medication. Talk to your doctor about getting this type of medication and continue to explore other birth control methods if you plan to be sexually active and do not want to become pregnant. To review, condoms, when used properly, can be effective at preventing pregnancy as well as preventing sexually transmitted infections. Other choices such as vaginal gels and spermicide are less effective at preventing pregnancy alone, but work well when used with condoms. All of these birth control options are easily obtained at stores in the United States. Withdrawal and fertility awareness are natural methods of contraception. The morning after pill or Plan B is an option if a method like a condom breaks or if someone unexpectedly had sex without using birth control. Although the options discussed in this video are not considered the most effective at preventing pregnancy, it's important to recognize that the decision to use a particular type of birth control method is highly personal. This video series provided you with information about long-acting, short-acting, barrier, natural, and emergency methods of contraception. You can discuss all types of birth control options privately with a doctor or healthcare professional. Remember, you can always ask for a female doctor and interpretation services in your preferred language to help you make informed choices that are best for you.